Well, thank you for coming back. It's Sunday the 22nd of March, and hopefully you've had a chance to watch the two more scientific videos I've just made recently. Now, I'm not going to pretend this feels like a normal Sunday. It certainly doesn't. There's a definite different feel to the people and the atmosphere where I am in the north of England, as these locking down measures are starting to take effect. And people seem, to me, quite reflective at the moment, realising that there is actually a threat to life going on. So, as of now, everyone needs to be 2 metres or 6 feet apart. The whole world needs to be physically distanced. And this is literally the whole world now. This is a pandemic in the truest sense of the word. Most people need to stay at home. Most people need to stay at home and not go out, basically. We live in a changed world for the time being. It is going to go back to normal. Things are going to improve, but not before they get worse first. Now, World Health Organization. Although older people are the hardest hit, younger people are not spared. So Dr. Tedros is clearly saying that this is not just a disease of older people, although they are normally hardest hit. He went on to say people under 50 make up a significant proportion of patients requiring hospitalisation. So this is quite sobering, really. Dr. Tedros says, today I have a message for young people. You are not invincible. This virus could put you in hospital for weeks or even kill you. Now, he did then go on to compliment the vast majority of young people in the world that have complied with the requirements of closing down and social isolation that are required. Now, how do you optimise your immune system? Well, the World Health Organization have said eat a nutritious diet helps your immune system to work properly. And I added vitamin D to mine as well. Limit alcohol is interesting. So they're officially saying limit alcohol to improve your immunity. Avoid sugars and sugary drinks. Don't smoke. This increases the severity risk. So this is a very clear message here. Data has accumulated, and indeed we surmise this way back from the early data from Wuhan, that smoking predisposes people to more severe infections. So if you do smoke, this is a good time to stop smoking. If you are drinking a lot of alcohol, then cut down your alcohol consumption. And Dr. Tedros also advised taking regular exercise, 30 minutes a day for adults, 1 hour a day for children. If you can go out, he advised exercising outside, depending on the local regulations in your area. As long as you're socially isolated, that should be acceptable. If not, keep moving around the house or the flat or wherever you live. Now, WhatsApp have also Facebook have also taken on some things from World Health Organization. Now, that is the number there. I have checked this and it does work. So here we have the World Health Organization app. I don't know if you can see it, it's a bit bright. There we go. So there's various things you can choose from there. And then you can scroll down and gives you more information. So protect yourself. Avoid touching your eyes, nose and mouth. Cover your mouth. Yeah. So useful information there from the World Health Organization on WhatsApp. So you just dial that number as a new contact, type in hi, and they send you back all this nice, interesting information. So keep you amused for quite a long time. And also potentially save your life, quite literally, quite seriously. Now, the World Health Organization is still saying testing, contact tracing, quarantine, social distancing. And this, we have to say, is in stark contrast to what is happening in the world. We believe this testing, following up contacts and things work because it seems to have worked in South Korea, but most of the world is simply not doing it. Now, the UK deaths increase. We're 2 to 3 weeks behind Italy in the UK, so we're not that far behind. Our curve is just slightly behind the Italian curve. Italy carries on being a distressing situation. 6,500 new cases yesterday, 6,500 new cases in the day, well over 50,000 cases now. Now, 4 weeks ago in Italy, there was one death. Yesterday, there was an extra 793 deaths, over 5,000 now. In fact, the number's greater because people are dying at home, are choosing to die at home. Now, the question is, why is this death rate so frighteningly high in Italy? I mean, we can see that that 5,000 deaths, we can see that's getting on for 10%, can't we? Of the numbers, even without doing any sums. So why is the death rate so high? Well, partly it's because Italians often live in extended family networks, so they can be grandchildren, parents and grandparents all together under one roof, meaning that the children have more opportunity to infect the grandparents. Italy does have an older demographic as well. And I don't know what it's like now, but when I was visiting Italy, okay, it's 20 years ago now, but the amount of smoking was appalling. I do hope I'm not judging the country wrongly, but that could be a factor. And the intensive care facilities in Italy, although they're world class, quite a lot of people that are going from intensive care and going on to die. So quite a few people are opting just to die at home with their family. And the other great tragedy is that people in intensive care, of course, are dying without their family by their side, which of course is tragic for everyone. But we can't have relatives going into a crowded, infected intensive care unit. So some people opting to die at home, which is understandable, especially given the relatively high mortality rate there's been in ITUs in Italy. Distressing to find there's quite a few younger patients in intensive care units in Italy as well. Encouraging to see the Russian military are going to help the Italian situation. And Cuban medical staff, nurses and doctors from Cuba, going to Italy to work with the people in Italy. So very, very commendable. After Cuba recently took in that British ship, and allowed the people from that ship to fly home. So good to see these national examples of altruism and reaching out. And excellent help there, I'm sure, will derive from the Russian military medical facility. Spain, again, terrible rate of increase. Terrible rate increase of deaths. The Spanish Prime Minister said the worst is to come. The Spanish curve is still very much increasing, so it's still going up. Quite where we are now, we could be about there. That means this could be to come. You know, we really don't know. Let's hope it's not as exaggerated as I've drawn it there, but the situation is getting worse. Now, the lockdown measures that have been taken will start to work, but they'll take a couple of weeks to work through. It'll take time to work through. So that's time along that axis there. That's cases up there. Let's hope the lockdown measures introduced in Italy are going to flatten the curve, making the situation altogether more manageable, kicking the whole thing back into summer when we've got rid of the seasonal influenza and we have more capacity. So the worst is yet to come in Spain. The Prime Minister said that. Let's hope it's a blue future as opposed to a red future. 5,000 bed hospital being built up in an exhibition centre in Milan. US, again, to be quite honest, the US is also at this sort of point here where things could go either way. I think the US and Spain are probably about there. Things are going to go on spreading. Official number of cases in the US. Now, New York, the sort of epicenter, only testing hospitalised patients now, only ill hospitalised patients. This is completely inconsistent with the World Health Organization. It's inconsistent with what politicians have been saying about the ramping up of testing. And it means that the American authorities are fighting an enemy they cannot see. The testing that was promised in the United States has not come about, and unfortunately the people of the United States are going to pay the price for that. Why on earth the testing has not been sorted out by now, I don't know, but it's a tragic situation. So the tests are for the sickest people at the moment. I'm not singling out the United States. My country's not a whole lot better. The testing is just inadequate everywhere. New tests are coming online, but it always seems to be next week, next week, next week. We need them now. New York area, New York, non-essential workers must stay at home from Sunday evening. Now, still in the Americas, the South American situations, most countries are being proactive, which is encouraging. Argentina, Bolivia, Colombia, full lockdown mode, airports in the process of closing. So the sort of proactivity here we're seeing in South America, we didn't see in other countries, unfortunately. Now, the West Bank and Gaza. West Bank, all internal travel stopped in the West Bank. And unfortunately on the Gaza Strip there, 2 cases from Pakistan have emerged and everything is closing down in Gaza. Difficult conditions there. It would be amenable to spreading of the virus in Gaza, as indeed in many situations around the world. Colombia. Now this is concerning. We've always flagged up on this video that the risk to institutions, and we've seen that fulfilled in prisons in various countries. We've seen that fulfilled in nursing and care facilities in various countries. So prison riots, a couple of riots in Bogota there and other parts of Colombia. Prisoners understandably anxious. But makes for a lot of civil unrest. Really shows we have to move forward on this together. India, not many cases, 14-hour curfew, 1.3 billion people, almost empty streets all over India. Quite incredible. I've spent some time working and done a bit of teaching in India, and when you walk out in India, it's kind of wonderful, but you get this amazing sense of chaos. It's not in an intimidating way. It's kind of great, but it's intense. And to see empty streets in India was just quite emotional for me to see, really. 14-hour curfew. I know that's not long, but it's slowing things down a bit. Mr. Modi decided to close things down and see how it went. Of course, a lot of people in India, as we talked about in South Africa yesterday, are just working from the hand-to-mouth situation. Long-term social isolation is going to be very, very, very difficult. And if you know anything about Indian railways, you know what a massive step that is to suspend the trains until the end of the month. India not particularly well off with doctors, and great wealth inequality in India. 600 million people in India are in what I would describe as extreme poverty, certainly significant poverty. And the conditions in India meant that 18 million people died in the 1918-1919 influenza pandemic. So it looks like the Indian authorities are aware of their history and are attempting proactivity, which I'm delighted to see, although my anxiety for India, Bangladesh, Pakistan remains very, very high, actually. Very high. The United Kingdom, my country, more cases, more deaths. The at risk, I think there's about 1.5 million people at risk in my country, and they're being contacted by the NHS to tell them to self-isolate for 12 weeks. So they don't go and get their own shopping, someone brings it for them. 12 weeks, a long time to stay at home. These are people, for example, with cancer, with immunosuppression, on immunosuppressing drugs, for example, after organ transplants. people with hypertension, chronic lung diseases, chronic heart diseases, diabetes at increased risk. Also pregnant women. The World Health Organization say they're not aware of any adverse effects in pregnancy at the moment. Let's hope that continues to be the case. But of course, every woman who is pregnant is immunocompromised by definition, and so has to consider themselves in a vulnerable category because of their reduced immunity. But so far, things are looking like pregnancies are going to go ahead as normal, which was a massive relief, especially if you watch some of the early videos in this series where we looked at SARS-1 and MERS. So thankfully, this particular coronavirus doesn't seem to have the adverse effects on pregnancy. Thailand, now 30% rise in a day from this boxing match. So people gathered around to watch people beat each other up and spread cases all around the country. Just shows that we haven't stopped sports and mass public gatherings any time too soon. And in fact, of course, we've stopped them way too late. Denmark, increasing cases for a small country. Germany, increasing cases. Bavaria in the south is locked down at the moment, probably going to be extended to the rest of Germany. Sweden, now I've been getting emails from people in Sweden that are quite distraught. Quite a few of them, or at least a dozen of them, I would say. And here's just a couple. Everything is open, even schools and visiting hours with the elderly. Sweden, I don't know anymore. Maybe it's time to give up. It's never time to give up. We fight this to the end. But I can understand your despair, the person who wrote this. As long as we don't testing me and many others with me who have underlying illnesses are sentenced to quarantine. As long as we do not see the enemy. See, we haven't got the testing. We don't know who to isolate and who to quarantine. So it looks like Sweden is inconsistent with World Health Organization guidelines. I don't know. It's easy to find examples of. I know it's easy to find examples of non-proactivity, as we've talked about repeatedly on this video. But if you're looking for an extreme example, please take a look at Sweden. This is an extreme example of non-proactivity. We have lots of community spread, estimates of 1% of the population infected, according to this writer. I can't verify that. Still, schools are kept open and there are no restrictions on restaurants or nightclubs. That just really... that strains credulity. That really does strain credulity. Even worse, ski resorts are kept open and lots of people are travelling there from larger cities this weekend. So a lot of travel within the country. I was talking about a ski resort, someone from Glencoe in my country, which is a skiing centre, and he was just so distressed and angry that people were travelling into his area from all around the country to ski in his backyard, bringing the viruses with them probably. Since yesterday, Friday, 9 new cases have been confirmed at the largest ski resort. We are repeating exactly the same mistake as Italy did just a few weeks later, and somehow expecting a different result. And of course, it would appear you and me know there's not going to be a different result. So life is going to be changed for the whole world for the next few months. There's no alternative to this. Well, there is. The alternative is a lot of people die. That is the alternative to this. So that means there's no alternative to this. We just have to work out how we can help each other through this time, but knowing things will improve. We don't know when, but things will improve. This pandemic will pass. Vaccines will be developed. Immunity will be present. But we just have to make sure as many of us get through this in as good a shape as possible. And that means there's a role for absolutely every single human being in this world to play their part. whether it's directly involving healthcare, whether it's maintaining essential services like food delivery or police or other essential services that we need, maintaining internets and things like that, or whether it's simply staying at home and watching Netflix. Everyone has got their role to play.